Dwarfism. Dwarfism, little person. Dwarfism is short stature that results from a genetic or medical condition. Height. Dwarfism is generally defined as an adult height of 4 feet 10 inches 147 centimeters or less. The average adult height among people with dwarfism is 4 feet 122 centimeters. Many different medical conditions cause dwarfism. Symptoms. Trunk of normal length, bowed legs, reduced joint mobility in elbow, shortened hands and feet, a large head, a flat midface, a flattened bridge of the nose. Behavioral signs. In abuse dwarfism, the behavioral signs include some or all of the following: a history of unusual eating and drinking behavior, reversible on change of domicile, such as eating from a garbage can and drinking from a toilet bowl, stealing food, rejecting food at the table, polydipsia and polyphagia, possibly alternating with vomiting. Aggressiveness, sudden tantrums, crying spasms, insomnia, eccentric sleeping and waking schedule, pain, agnosia, and self-injury, all occurring only in the growth retarding environment, retarded motor development, retarded intellectual growth. Types of dwarfism. Disproportionate, proportionate. Disproportionate dwarfism is characterized by an average-sized torso and shorter arms and legs, or a shortened trunk with longer limbs. Proportionate dwarfism, the body parts are in proportion but shortened. Here is a pictorial representation of disproportionate and proportionate dwarfism. Causes of dwarfism: growth hormone deficiency, genetic disorder, hypothyroidism, skeletal dysplasia, malnutrition, or lack of food. Now we will discuss the main cause of dwarfism, which is skeletal dysplasia. Types of skeletal dysplasia: achondroplasia, main cause, then atrophic dysplasia, hypochondroplasia. Achondroplasia. It is the main cause of the dwarfism. Achondroplasia is a form of short-limbed dwarfism. The word achondroplasia literally means without cartilage formation. Cartilage is a tough but flexible tissue that makes up much of the skeleton during early development. Here you can see the symptoms of achondroplasia, which is the main cause of dwarfism, such as short and long bones, flat bones, large head size, etc. Growth hormone deficiency. It is a cause of dwarfism and is caused when any problem with pituitary gland. Its deficiency is rare in children between 1 in 3,000 and 1 in 10,000. Deficiency of growth hormone causes pituitary dwarfism. Pituitary dwarfism or growth hormone deficiency is a condition in which the pituitary gland does not make enough growth hormone. This results in a child's slow growth pattern and an unusually small stature, below average height. Genetic or not. Dwarfism is a genetic disorder caused by mutation of gene at chromosome number 4. Most dwarfism-related conditions are genetic disorders, but the cause of some disorders are unknown. Most occurrence of dwarfism result from a random genetic mutation in either the father's sperm or the mother's egg rather than from either parents' complete genetic makeup. Diagnosis. Genetic testing when a fetus is still developing through X-ray. Some forms of dwarfism are evident in utero at birth or during infancy and can be diagnosed through X-rays and a physical exam. A diagnosis of achondroplasia, dystrophic dysplasia, or spondyloepiphyseal dysplasia can be confirmed through genetic testing. Prepubertal growth velocity less than 4 cm per year. Living with dwarfism. Many people with dwarfism suffer from the most difficult part of their condition is the stigma it carries. This stigma may include bullying and employment discrimination, as well as the use of negative terms like midget. Treating dwarfism as a disability makes very short people feel stigmatized.
Problems during infancy and childhood. Breathing difficulties, ear infection, bowed legs, increased lumbar lordosis, reduced muscle strength, hydrocephalus, and narrow foramen magnum. Problems during adulthood. Nerve compression, obesity, crowded teeth, and risk of pregnancies.
Treatment and medication. Human growth hormone. Some metabolic and hormonal causes of dwarfism may be reversible. Injections with human growth hormone, for example, can help people with a growth hormone deficiency grow to a normal height. The most common causes of dwarfism, however, are not curable. Instead, treatments focus on managing the symptoms, including surgery to correct the abnormalities in bones and spinal cord, removing the tonsils and adenoids to make it easier to breathe, spinal decompression surgery, using a tube called a shunt to drain fluid from brain, lifestyle changes such as exercise and weight loss.
Thank you. Presented by Group 7. Leader Isra Shakil Khan.
Fahad Saeed,
Laiba Iqbal, Jeeta Sabra, Shafaq Shoaib.